So if I had a client with high blood pressure, it would mean that the pressure of blood in their arteries is elevated. So they'd be prone to headaches, lightheadedness, and even fainting. High blood pressure can lead to heart attacks, strokes, and kidney failure. Normal blood pressure is approximately 120/80. Anything over 140 is considered high. It's generally caused by drinking, smoking, poor diet, no exercise, stress, genetics, or high cholesterol. So exercise is very important to help lower high blood pressure. Even though it actually goes up during the exercise itself, it's actually during the rest periods when you're doing it on a regular basis that you see the improvement. So in terms of modifications for when exercising, you need to make sure that they do a good warm-up to get the body moving and prepared for exercise instead of going straight into it. So it needs to be eased into it. The heart rate should be monitored throughout the entire session, just to make sure that they aren't overdoing it, and to check in with the client themselves to make sure that how they are feeling. They must ensure that they do a cool down, so again gradually letting the body recover and come back down. They shouldn't ever just stop or sit or lie down, because this could cause dizziness or palpitations. If they are considered very high blood pressure, you need to make sure you get clearance from their doctor to ensure that it's safe for them to train. And people with high blood pressure should be doing at least 30 minutes of exercise every day, just to help lower that. Nothing too intense, so no heavy weightlifting and no competitive sport. If they do prefer to train with weights, they need to do light to moderate weights, so not to suddenly increase the heart rate. And it's the same for cardiovascular exercise, just a nice moderate intensity such as a brisk walk or swimming, and no push-ups or movements that involve standing up quickly from the floor. Now if I had a client with lower back pain, this can come from anything from incorrect movements or long-term high-impact exercise. People with lower back pain need to avoid exercises that put pressure on the lower back. So this could include leg lifts, straight leg sit-ups, and also leg curls. And also they need to avoid any sudden twisting movements. It's actually really important for people with lower back pain to maintain an exercise regime to keep the mobility. If the pain increases during exercise itself, they should stop. They should never push themselves. They shouldn't be feeling pain at all. They should do low impact aerobic exercise like cycling, swimming, walking. Lots of stretching to improve mobility and flexibility, and this will also help to reduce the pain. And also spine stabilization and strength training exercises. So if they can really train their core, that'll help to give them support in the back that they need. And finally, for somebody that's got a knee injury, they need to avoid putting any extra pressure on the knee joint. And the best way to go about this is to actually strengthen all the muscles around the joint, and that will decrease the stress on the joint itself. They must make sure that their knees should never stick past their toes during bending movements such as squats. If they do squats, they should only do partial squats. And so they're only going halfway of their full range of motion, and they must keep the abs tight just to really support the body, and the knees need to stay behind the toes. For exercises to help improve mobility, they can do step-ups using an aerobic box, so stepping up 1 foot at a time and then